Hello, hello, hello. We are back for another edition of the Forks Over Knives webinar series. Today we are here with none other than Dr. Angie Sadeghi. Dr. Sadeghi, how are you today?
I'm doing excellent. How are you?
I'm doing fantastic. I'm doing fantastic. I'm actually very excited to hear the talk that you're going to give today. I heard little snippets of it last week. About gut health and how you can improve your gut health using a whole food plant-based diet. I've been following your work for the past couple of years, and personally, I find gut health to be fascinating. So I feel like there's a lot of people in today's world who really don't know that much about gut health, or sort of like heard murmurs about the fact that your diet definitely influences your gut health. So I'm hoping that we can get into a lot of detail today and learn a lot about it.
I'm excited.
Fantastic. So today's webinar is going to be specifically about IBS and gut health. And Dr. Sadeghi is a world's expert on IBS and many other aspects of gut health. And she's going to go into a lot of detail here about what is IBS, what causes it, and how you can actually change or manipulate IBS to your advantage. She always comes prepared to share a ton of evidence-based information. So if you don't have a notepad and pen handy, then go grab one right now, because trust me when I say there's a lot of information that's going to be coming in this webinar. And even if you have an opportunity to take a couple of notes or draw a couple of pictures, it'll help you retain the information into the future. So there's already a total of over 1,100 people here, and I'm sure we're going to get even more than that. So if you are here with us right now, first of all, thank you for being here with us in the middle of the day. Do me a favor in the chat box and tell us your name and where you are from. We love to see just how diverse of an audience we have and from what different parts of the country and maybe even what other countries you guys are coming from. So don't be shy. Angie, can you see the chat box by any chance?
I can see things flashing through. Yeah. Thousands of people writing in. This is
That's
exciting.
Right.
I saw New York, Arizona, Texas. Look at that. Wow.
Sometimes I don't even know why I ask people to write things, because it comes in so fast it's impossible to read.
Kind of cool. We can look at these later
yeah. Okay, so now another thing that I would like you guys to do is, if you are plant-based, write the number 1 in the chat box. If you are not plant-based, write the number 2 in the chat box. And then if you're somewhere in between plant-based and not plant-based, write 1.5. And that will give us a good idea here of the approximation of what you guys are currently eating and what you guys are currently following. Again, even just single numbers is hard to look at, but I see a lot of 1.5s coming in. There were a lot of 1s originally. If I had to take a guess, I would say that the audience is at an average of like 1.4, maybe like 1.3, something like that. So okay, so we're gonna have a lot of fun here today. We're Dr. Sadeghi. She is an integrative gastroenterologist and a diplomat of the American Board of Internal Medicine and the American Board of Gastroenterology. In other words, she's incredibly smart. She's the president and the CEO of the brand new health institute known as the Institute of Plant-Based Medicine, and that is in Newport Beach, California. And she is the co-author of a book called The Trifecta of Health. She's got extensive training from the University of Southern California, and she, in her entire career, has been committed to the excellence in treating diseases, specifically of the digestive tract. So today, Dr. Sadeghi is going to teach us a couple of things. Number 1, what is IBS? You're going to be able to, by the end of this, you guys will be IBS pros, and you'll be able to understand the causes and the effects, and most important, what are the actual symptoms of IBS? Because if you're living with some type of gastrointestinal discomfort, gas, bloating, constipation, diarrhea, you name it, some of those might be linked to IBS, some of those might not be. Number 2, you're going to learn about food allergies, how food allergies and food sensitivities and IBS are actually linked together. And you're going to get Dr. Sadeghi's take on the low FODMAP diet. I'm sure you guys have probably heard about the FODMAP diet before. And in case you haven't, she's going to give you some insight into that. We're also going to learn about how integrative medicine can treat IBS by blending evidence-based nutrition and lifestyle changes with cutting-edge medical approaches. So there's a lot to be learned today. Dr. Sadeghi, how is life in Southern California right now?
Sunny, warm, and beautiful.
That's awesome. That's awesome. So yeah, you guys have been creating your the health center over the past year now. Is that right?
Yes, it's so exciting. We brought all these evidence-based practitioners who are passionate about helping people integrate nutrition into their practice. And I'm just feeling amazing about this because we are going to help so many people prevent disease, reverse disease. And, you know, we're not against the Western medicine and medications, but we want to minimize that as much as possible. So we want to integrate nutrition to help people improve their disease process without the use of medicines, hopefully.
You know, it's always funny to me how the term reversal, disease reversal, is like this new concept in the world of medicine. And there's a lot of traditional doctors who don't necessarily understand what that really means and how you can actually reverse pathological processes like hypertension, high cholesterol, diabetes, you know, diseases of the gastrointestinal tract. So the fact that you guys are focused on not just managing, but reversing is incredible.
Thank you. Yeah, that's the goal.
Absolutely. So just a quick rundown. And for those of you guys who don't know who I am, my name is Cyrus Kambata. I have a PhD in nutritional biochemistry. I've been hosting these webinars for the last couple of years. I have been living with type 1 diabetes myself since the year 2002. So that's 18 years. And in the process of transitioning to a plant-based diet, even before forks over knives was a thing back in 2003, I found incredible benefits to not only my blood glucose values, but my insulin use also went down dramatically. In addition to that, my energy levels are through the roof. I can exercise as much as I want. I feel like $1,000,000. I'm the co-founder of a business called Mastering Diabetes, and we teach people living with all forms of diabetes how to transition to a plant-based diet to improve their overall health. I'm going to be your host today. So Dr. Sadeghi is the expert. I'm just going to be here to make sure that this whole thing goes down exactly the way we would like.
We couldn't have asked for a better host. Thank you.
Why, thank you so much. So before we get into the presentation today, let's just check we got a total of about 1,500 people here right now, which is fantastic. So before we get into our presentation, which again is going to be action packed, I'm going to show you guys the Forks Over Knives meal planner, because I really want you guys to learn about what it is and see how it can actually make a huge difference in your life. So I'm going to switch over right now. And I'm going to share my screen and see if you guys can see this. Here we go. Okay. So one of the things that I love about the Forks Over Knives team is that they are truly committed to making it possible for people living with all forms of, for people living around the world, either living with chronic disease or not living with chronic disease, transition to a plant-based diet. They truly just want to make everyone healthier. It's just that simple. And just like Dr. Sadeghi, they understand that adopting a whole food plant-based diet can result in a number of positive changes to your body. So one of my favorite tools that they make is this Forks Over Knives meal planner, which I'm going to run you through here in a second. This is a tool that I've been using for myself and have been recommending to all of my clients living with all forms of diabetes. It's completely free to try for 2 weeks, and I want to show you guys exactly what it's all about. So let me show you what it looks like on the inside. The first thing you're going to do when you get inside of the meal planner is select your goal. And then you're going to select how many people this meal plan will be for. You can select whether you have any food intolerances or any preferences. I don't, so I'm just going to say next. Next, you'll create an account by typing in your email address, and then you'll enter your name and write down your password. This account is free and there's absolutely no credit card required. You'll get 2 weeks for free to try it out. And this is a 100% risk-free trial. Now, when you get inside the meal planner, the first thing that you're going to see is your meal planning dashboard. Every week, the chefs at Forks Over Knives will send you a 5-day meal plan with delicious recipes that can all be prepared within 35 minutes or less. You can also add the 6th and 7th days if you choose. Another great thing about the meal planner is that it is 100% customizable. So as an example, I can simply click to remove this spinach artichoke dip because I don't want it. Okay, it's not part of my meal plan. I'm not excited about it, right? And if I'm really not feeling like the veggie fajitas on any particular day, I can just click swap and I can choose something else. So the meal planner is going to let me browse for a recipe, or I can even type in the ingredients that I have in the fridge, which is truly unique. So in my fridge right now, I have tomatoes, I have lentils, and I have carrots. Now you'll see a whole bunch of recipes that are presented, and we can scroll through all these delicious recipes. And personally, I like the lentil bolognese right here in the top. And I'm going to click on that guy because I really want that in my meal plan. So when it gets to the meal plan, if I want to switch that out with the green goddess bowl because, I want to flip flop their positions, I can literally just drag and drop the lentil bolognese for the green goddess bowl, and that's that. And there you have it. That's my entire meal plan for the day. But something that's really cool about this is that this meal planner auto generates my grocery list and my weekend prep cheat sheet. So let's go into the grocery list next. Don't forget, you can try all this stuff out for 2 weeks for free. Okay, in this grocery list, it has all the ingredients that I need for my meal plan, and it's already added. So I can check off the items that I already have at home. And then I can access this meal planner when I'm shopping for the items at the store. I can also add my own ingredients to the list if I need other things. So in today's world, everyone needs toilet paper. So there you go. I'm just going to add that right there. Okay. Now, one of the features that I think really sets this meal planner apart from everything else, besides the fact that you can also get toilet paper, is that there's a weekend prep cheat sheet. And here you'll get the weekend prep guides that teach you how to cook, how to bake, and how to freeze everything so that you can really use everything to it in the most efficient manner. And you can do this and it'll save you time and it'll save you a lot of money. Okay. The weekend prep streamlines things so I can literally just throw meals together to save myself a lot of time on busy days. And with one click, I can even print everything out to a PDF. And then I can take that PDF and I can do whatever I want with it. So there's plenty of stuff to explore in the meal planner, but hopefully you guys get a little flavor for how it works. If you're considering joining the meal planner, or even if this is your first time hearing about it, be sure to take advantage of the 14-day free trial. There's no credit card required to try it out, and therefore you have nothing to lose. So simply just go to forksoverknives.com/loveplants and get started for free. The link is also in the chat box for you as well. You're going to be amazed, just like I was, at how easy and fun it is to create delicious meals every single day. And the Forks Over Knives team is here to make your transition to a plant-based diet a success. So with that in mind, now we can transition over to Dr. Sadeghi. You ready to take this webinar to the next level?
Yes, that was pretty cool.
I know, it's a really amazing
toilet paper. I was like, is it going to spit out a recipe with toilet paper?
Yeah, that's next week's meal plan, actually.
Advanced. All right, let me find this presentation here really quick.
Okay. So for those of you who are interested in learning about gut health, there's a few gut health experts on the planet that I personally consider to be the smartest people in the world when it comes to gut health. Dr. Angie Sadeghi is absolutely one of them. So you guys are very fortunate to be here with her today. And any questions that you guys have, throw them in the chat box, and we're going to do a Q&A at the end, and hopefully we can get to as many of those questions as possible.
All right, I'm going to talk about irritable bowel syndrome. Here's our website if you guys are interested. Thank you for inviting me today. I'm really excited to talk about irritable bowel syndrome because it is a chronic disorder of the GI tract, and so many people suffer from irritable bowel syndrome. The prevalence rate in North America is reported as 12%. I would say more than half of my practice is irritable bowel syndrome. It usually occurs in patients younger than 50 years of age. I put this up here for you because just looking at this, you'll see how a doctor considers irritable bowel syndrome as your diagnosis. There's something called the Rome 4 criteria for IBS. And so if you qualify for this, they give you this diagnosis of irritable bowel syndrome. Usually you have to have some kind of a pain, abdominal pain that is chronic, longer than 6 months, that occurs 1 time per week or more. The pain is related to defecation. There is a change in the frequency of stooling and a change in the form or appearance of stool. There are some red flag signs that must be considered. So your doctor will make sure that if you're older than 50, they would do a colon cancer screening test for you to make sure it's not colon cancer manifesting as pain and changing the bowel habits. They would make sure that there's no bleeding, such as red blood or black blood, which is called melena. Those things need immediate attention. If the passage of stools at night, that's a little bit weird. Usually irritable bowel syndrome with the bowel habits problems occur during the day. If there's unintentional weight loss, family history of colon cancer, and some other things. So your doctor will evaluate all these things before they say, oh, you have irritable bowel syndrome. If you want to know what irritable bowel syndrome feels like, imagine someone's like putting their hands and fists inside your belly and squeezing your colon. This is a very painful condition. The pain can come suddenly and feel like cramping pain, and it's just awful. It really lowers people's quality of life. And people usually have alteration in bowel habits where the bowels can be, the stool could be a type 1, which is like rabbit pellets, very hard stool, hard to evacuate. People get a feeling of incomplete evacuation. Type 2, which is also hard and abnormal. Type 3, same thing. Type 4 is supposed to be normal, and IBS patients can often have normal stools, but it will fluctuate from type 1 to type 7, which is watery stools. So people with IBS will come with extremes. Some people will have type 1 and 2 all the time. Some people will have type 6 and 7 all the time. And then there are other people who just kind of fluctuate on a daily or weekly basis. So there are about approximately 40 to 60% of patients experience comorbid psychological disorders such as depression and anxiety. I'd say I only have a handful of patients in my clinic who have IBS who don't have either depression or anxiety. So it's very common. So if you have this, you're not the only one. There's also higher levels of somatization compared to patients without IBS. This is placing significant focus on physical symptoms such as pain and weakness that result in major distress. The individuals have excessive thoughts, feeling, and behavior related to their physical symptoms. Not surprisingly, IBS has been shown to negatively impact patients' quality of life. People spend a ton of money on treating their IBS. You know, most people start with their family physicians. Then they end up going to 1, 2, 3, or 4 gastroenterologists. Then when they continue to have IBS symptoms, they usually go to alternative medical practitioners. They spend tons of money. And today I want to kind of teach you what IBS is about and how it's caused, and teach you pathophysiology of IBS. And once you've had some workup, I want to reassure you that you're going to be okay, so you don't fall into the same trap of spending hundreds of thousands of dollars trying to treat your disease. And at the end of the day, by doing some of these non-evidence-based practices, you could actually ruin your health, not help your health. So I want to hopefully walk you through this. Most people with IBS have had imaging studies, laboratory studies, stool studies, breath tests, and everything under the sun, and they're still having problems. And you know, so it's really important for you to get some kind of reassurance and not keep doctor shopping or practitioner shopping. So pathophysiology of IBS, which causes gut dysfunction. There are 1, 2, 3, 4, 5, 6 here that I'm going to go through with you slowly and teach you every single one of these 6 things that cause IBS. And one may have one, not the other, but most people have everything going on at the same time, which causes the symptoms. And then I'll talk about diet. I know you've all been waiting for that. So after the pathophysiology, I'll dive into diet a little bit, and I'll conclude with certain treatments. So if you look at the epithelium of the gut, so it's a long tube that has blood vessels coming into it that bring blood for oxygen and drain blood with nutrients away from the gut. Inside the gut, it's so exciting. There's these villi, which are like, they look like finger projections inside the gut that line the gut's lining. If you look at the villi under the microscope, it's just these peaks and valleys. And these peaks and valleys increase the surface area of the gut and allow all these nutrients to get absorbed into the blood vessels and away from the gut and into the rest of the body. So if you actually look under the microscope at the villi, but just pay attention to all the cells, like we're just getting very cellular and very microscopic here. These cells are joined together via these things called the tight junctions. So I wish I could like point to things. I don't know if you can see my pointer, but these are tight junctions. And what they do is they hold these cells together. So these cells are holding hands via these tight junctions. On top of the cells or the epithelium are these villi, which I told you grab the nutrients. On top of the villi is this healthy mucus layer that protects the villi and the rest of the cells from pathogens. So there's all kinds of pathogens, good bacteria, unhealthy bacteria, viruses, everything that lives on top of this mucus layer. The health of this mucus layer is important because if that mucus layer is gone, what happens is the bacteria and food particles and toxins can freely find access into the blood vessels, and that is called leaky gut. So the mucus layer is important, so are these tight junctions between the cells. And so the figure on the right shows what happens if the tight junctions are gone and the mucus layer is destroyed. Things just free flow inside the blood vessels, and that is called leaky gut. But how does that cause inflammation? In this cartoon, what you're looking at, actually was in a paper where it talks about what happens if you eat a high fat diet, not just any fat, but saturated fat. You look at these cells are all tightly bound together. These goblet cells, which are producing that mucus layer I was talking about, there's microbes living on top here. But over here, underneath the cells, we're getting a little bit more detailed now, and I'm going to show you what happens when you get leaky gut and how you develop inflammation. Over here, normally you have these white cells living under here. These are lymphocytes, but these lymphocytes are in a state of health right now, and they're producing cytokines that are anti-inflammatory. So this is all, everything's going well, things are good. But this is what happens when you get that leaky gut, where you get the tight junctions are severed and the mucus layer is almost gone. What happens is you get these fatty acids that free flow inside the submucosa, or the lamina propria it's called, and all these bile acids that come in here. And guess what? Those nice lymphocytes that were sitting there and they were anti-inflammatory suddenly get angry because they're encountering lipopolysaccharides, bile acids, and oxidized fatty acids. And the lymphocytes get stimulated, angry, and they start spilling out or spitting out all kinds of cytokines and pro-inflammatory molecules. And that's how you develop inflammation here. This was a high saturated fat model that I adopted from this paper, but we'll talk more about nutrition in a little bit. But what happens if you're eating a fiber-free diet? So in this schematic diagram, the authors here showed that if you're eating a fiber-rich diet, there's steady state here, the cells are happy, they're tightly bound together via the tight junctions, the mucus layers is intact, the organisms are living on top of the mucus very nicely. Here's what happens if you take fiber away. In a fiber-free diet, these organisms that love fiber start eating the mucus layer. And when they eat the mucus layer, the mucosa gets exposed to bad pathogens. So it's really important. A high fiber diet is key for a healthy gut. The gut microbiome is not just bacteria. There is bacteria, viruses, fungi, archaea, and protozoa. Collectively, the genome contains at least 100 times as many genes as our own eukaryotic genome. In this figure, you can see the gut microbiome living on top of the villi. There are 100 trillion of them living in a symbiotic relationship with humans. There are some in the stomach, there are some in the small bowel here, and the majority of them reside in the colon or the large bowel. If this balance is somehow disturbed and there is more bacteria than normal living in the small bowel, that's a condition called small intestinal bacterial overgrowth, which is very closely related to irritable bowel syndrome. And I'll talk about that in a little bit. So remember I told you that there are several mechanisms that cause IBS, and we talked about IBS being caused by the tight junctions being severed, but the second mechanism is dysbiosis. The gut microbiome is disturbed. There are microbiota species that are increased in patients with irritable bowel syndrome, such as the ones listed here, and there are microbiota species that are decreased in irritable bowel syndrome, such as the ones found here. So there's definitely dysbiosis going on in irritable bowel syndrome, besides the tight junctions being severed. There's organisms called archaea. Archaea are not bacteria. They're their own they're in their own little world, and they act very differently than bacteria, and they don't get killed by antibiotics. But usually the intestinal gases are removed by these methanogenic archaea organisms. They produce methane gas. Normally, these archaea remove the gases, but there seems to be a depletion of these archaea organisms in patients with IBS. So the gas perhaps hangs around longer. And they're negatively correlated with presence of loose stools. So basically, if there's a lot of archaea methagenic producing bacteria, there is more constipation. If there is less of them, there's more diarrhea. So less archaea means more loose stools. Abundance of archaea is what causes a lot of constipation, and patients usually with irritable bowel syndrome with constipation have abundance of archaea species. So there's definitely dysbiosis going on. But maybe it's not IBS, maybe it's SIBO, and that is something that has to go through every person's mind, every gastroenterologist who's evaluating patients with irritable bowel syndrome, because a significant majority of patients with IBS have concomitant SIBO. And SIBO is a condition where there's overabundance of bacteria or organisms in the small bowel where it doesn't belong. And there's overproduction of gas. This causes people to feel super bloated. And you see this patient is feeling super bloated, but a lot of times they don't even look bloated, but it's the feel that counts. People feel so bloated, they feel like a balloon. They tell me that they wake up in the morning with a flat stomach, and during the evening they feel like they're pregnant, and they show me before and afters, and it's pretty significant. But so we talked about tight junctions being severed, we talked about dysbiosis, we talked about SIBO, but the third way that you could have IBS has to do with the immune response. So how do we know the immune response is even involved in people with IBS? Because infectious gastroenteritis is a strong risk factor for development of IBS. In fact, 20% of IBS patients describe an acute infectious GI syndrome several months or years before, and occurs between 40 to 30% after bacterial or viral enteritis. It's usually diarrhea predominant. And, I can tell you, I have about 5 patients listening right now who had this happen to them. And so the typical story, someone goes down goes to a country, like let's just say Mexico, because we're close to Mexico and a lot of people travel there. They have some kind of a traveler's diarrhea. They come back, they get rid of their diarrhea and their infection, and they get stuck with IBS for the rest of their life. So this is called post-infectious IBS. And many people describe this happening to them, having had happened to them before they got diagnosed with IBS. As far as the immune response, so then you may say, okay, fine, there's a history of some kind of an infection, but how do we really know there's an immune response involved? Well, if you look at the mucosa of patients with IBS, you will find T cells and mast cells hanging around. And I found this in a study where it shows there's all these mast cells. Left side, it's normal. Right side, there's more purple. There's mast cells sitting in there. And so what happens exactly? These mast cells are kind of cool. They have these granules basically inside of them. And when they get angry, they release these granules. It's basically considered as centennials strategically located in the interface between the host and the external environment. So what happens is there's two ways where they get activated. If there is IgE, this is an immunoglobulin that has recognized an allergen in the past and is swimming in your blood. And as soon as it sees an allergen, it can bind to this receptor and cause the release of these granules. Or it could just be a neurohormonal stimulation like stress that causes release of these granules. When they get activated, these mast cells release these biologically active granules such as histamine, serotonin, and proteases, cytokines, and other metabolites. And so depending on what kind of granules are being released, you'll have different allergic responses. Histamine causes itching, serotonin can cause diarrhea, proteases I'll talk about later can break stuff down in the GI tract. Cytokines and other metabolites can cause pain. So these mast cells are very important to play an important role in allergies and IBS. So let me show you what happens. If you look at this purple cell, this is a mast cell. This mast cell is sitting right under those cells that we talked about. And they produce histamine and proteases. These histamine and proteases can really irritate these visceral efferent nerves. These are the nerves that are traveling right underneath the cells of the gut. And they're actually also communicating with the muscles of the gut. So these mast cells release these histamines and proteases and really activate these nerves and irritate these nerves. So you can see there's so much going on underneath the gut cells. And these food particles here, imagine if there's no tight junctions, right? If the tight junctions are severed, these food particles can come irritate these mast cells. Mast cells do produce these granules, release these granules, and that causes the nerves to get damaged. Not damaged, irritated. So, but perhaps there is this sensitivity of the enteric nervous system, and that has been studied. And there's basically, it shows that perhaps the nervous system in irritable bowel syndrome patients is just overreacting. I put the picture of this woman overreacting, and that's true that perhaps there's more mucosal neurons sitting inside the bowel of someone with IBS compared to someone who doesn't have IBS. And that's where this exaggerated nervous response comes from. But if you look at this study, what they did is they put gas and fat lipids inside people's bowels, and they looked at what happens with healthy patients and IBS patients. It turns out that there's more gas retention in IBS patients than healthy individuals. The abdominal distension was worse in patients with IBS rather than healthy people compared to healthy people. And the patients actually reported more abdominal pain and symptoms compared to healthy people. So there's definitely an exaggerated response. This other study shows that if they took people with no IBS and patients with IBS and they put gas inside both people, equal amounts of gas, the patients with IBS are like, ouch, this hurts. People with no IBS they're indifferent and they just don't even feel pain. So there's definitely an exaggerated neuronal response. What about the brain-gut axis? Could the brain-gut axis be involved? Absolutely. Why? How do we know that? Well, number one, IBS is nearly always associated with increased anxiety and depression. Patients have comorbidities such as chronic pain, psychiatric conditions, fibromyalgia. And so there is more of a widespread dysregulation of the immune system and nervous system that you think of. The brain absolutely influences the gut. The brain influences the intestinal motility or movement, fluid secretions, the epithelial permeability or leakiness, immune function, and the gut microbiome composition. And I'll show you that in a diagram here. So the brain sends orders to the, so here's the brain. It sends all kinds of signals through the spinal cord, and the spinal cord through thousands and millions and billions of trillions, I should say, of nerves sends signals to the GI tract and the adrenal gland. So the brain, spinal cord, and the GI tract are absolutely connected. the signals from the brain comes down to the GI tract. These are called the enteric nerves, and the enteric nerves produce molecules that basically influence the gut microbiome, which produce other molecules, and that circles back to the brain. So it goes from the brain to the spinal cord to the enteric nerves. Stuff gets produced, the gut microbiome is influenced, signals get produced by the cells and by the gut microbiome, and signals circle back into the brain. So this is called the brain-gut axis, and it's a circuit, and everything comes into the gut, things get influenced, and influences go back into the brain. That's the brain-gut axis. And imagine all these enteric nerves that sit under the cells and are being influenced by the gut microbiome, by the nutrients that you're eating, by everything else. These nerves influence the muscles that are sitting right underneath the epithelium layer. There's more nerves. So there's tons of nerves that are just traveling through the gut under the cells, influencing the muscles. So for example, if you're having some kind of a diarrhea disorder, perhaps these are excitatory nerves that are being producing a lot of excitatory neurotransmitters, which excite these muscles that are traveling under the cells, which move fast, and that gives you diarrhea. The opposite is true too. If you have inhibitory stuff going on and these nerves slow down the gut, then what happens is the muscles don't move fast enough, then you don't have enough peristalsis going on and you get constipation. So what about bile acids? That was the last mechanism that I had listed under pathophysiology. And yes, it seems like bile acids have something to do with it as well. So that's why a low fat diet is always recommended. My dietitians and I put all my patients with, our patients with irritable bowel syndrome on a low fat diet, meaning low in saturated fat, not good fats. So you do want to eat more of the good fats like avocados and nuts and seeds. There's a picture of fish here. I'm not condoning that you eat fish. Morally speaking, I'm not for that, but you know, the fats, if you're gonna eat meat, I hope it's not one that is contains a lot of saturated fat. You want to consume a lot of the omega-3 fatty acids rather than the saturated fat found in beef and cheese, ice cream and French fries and all those so-called bad fats. What happens is that when you eat a high-fat diet, CCK gets produced and stimulates your gallbladder to produce a ton of bile acids. And bile acids, so this is a study that shows that the bile acids are tremendously higher in when you eat a high-fat diet, especially saturated fat I'm talking about. And these bile acids convert via the gut microbiome. The enzymes by the gut microbiome turn into secondary bile acids, which are toxic to the gut. So the lower the fat content, which is bad fats in your diet, the better off you are. So I know you've been all waiting for me to dive into diet. It's like, okay, we understand what causes IBS, but what do we do about it? All right, well, there's this low FODMAP diet that has been studied in IBS, which is low dietary content of fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. Obviously, that's very difficult to repeat, so we call it the FODMAP, low FODMAP, so low levels of all these things. It can improve symptoms of some, but not all, IBS patients. I can tell you I'm not a big fan of this diet. I'll show you why. These are really good stuff that you're eliminating out of your diet. And I'll show you some other things. So pretty much common foods containing FODMAPs, tons of fruits, vegetables, grains, legumes, and a lot of these things happen to be very good for us. And they actually inside the gut lead to the production of short chain fatty acids, which I'll show you are really good for us. So when you avoid these great foods based on the low FODMAP diet, you're actually perhaps hurting your gut, not helping. Now, very early in my career, I looked at this and I was like, oh, look at this, there's lactose here. So maybe people feel better when they do the low FODMAP because they're avoiding the lactose and the dairy. So I started asking my patients, not to do the full FODMAP, but just avoid the dairy. And lo and behold, people felt so much better. Some people still continue to have problems. So if you're having IBS symptoms, the very first thing you want to do is avoid lactose and all dairy and see what happens. Of course, you know, there are people with other things, but I'm just saying that's one of the first things you should do. But what are the limitations of the FODMAP diet? Eliminates a lot of prebiotic-rich foods, decreases the gut microbiome diversity. Some people end up eating a lot more animal products with saturated fat, which I showed you was not good for you because they're so limited on the low FODMAP diet. It does not cure IBS. It's merely a band-aid therapy. It's a short-term solution. Even the authors of the paper who introduced the low FODMAP diet said not to go on beyond 6 weeks. Reintroducing of foods is so difficult. It's like, how do you know what to bring back, right? It's just very difficult. And they compared this low FODMAP diet to this traditional dietary advice for IBS. And guess what? This was a large study, randomized controlled trial. Both did the same. So really, there's nothing special about the low FODMAP diet compared to the traditional advice, which was, hey, eat less legumes and cauliflower and eat smaller portions. So there's nothing special about the low FODMAP diet. And honestly, the very first thing people should do is avoid dairy. So why not avoid all these FODMAPs? So I'm sorry, why am I saying not to avoid the FODMAPs? And why am I saying don't do the low FODMAP diet? Well, simply because fiber-rich foods and FODMAP foods basically get digested by or fermented by the gut microbiota and produce short-chain fatty acids such as butyrate, propionate, and acetate. These are called short-chain fatty acids, which actually stimulate the cells of the gut to produce all these anti-inflammatory products and molecules, which cause the inflammation under the mucosa to go away. So these short-chain fatty acids are so essential for the health of your gut. Furthermore, besides their anti-inflammatory effects, they keep those tight junctions between the cells very tight and intact. And they, remember I showed you the goblet cells? They stimulate the goblet cells to produce mucus that nicely shown schematic thing in the blue shows that this is like the mucus layer that's nicely covering the cells. So these short chain fatty acids are so essential for the integrity of the gut lining. And so whenever a diet asks you to eat less fiber, you have to realize that it may not be a good long-term solution. In this study, they showed the most common food sensitivities and most common food allergies are as such. All right, so I see a lot of people come to my clinic and they say, you know, I was having problems. I was a vegan and people told me to eat fish and eggs. Really? Because that's like two of the most common food allergies, fish and eggs right there. Dairy, yes, I agree 100%. Now, what I do is I test my patients for wheat sensitivity and wheat allergy and tree nut allergies. And I always tell people, do not eat dairy. It is bad for you. If you, I mean, obviously, morally speaking, eating dairy is in my opinion, absolutely criminal. However, if you don't care about the moral reasons, look at how the prevalence of lactose intolerance is so much higher in patients with IBS than the controls. So dairy is definitely not a good thing. What about a high protein diet? So should you eat a lot more protein and lower your carbs because you don't want gas production? Well, let's look at the data. It turns out that people with IBS may have problems with protein degradation. The luminal content of patients with IBS shows that there is a lot of proteases. These proteases break down protein. And so this could be due to the increased secretion of proteases from the gut microbiome, or it could be because people are eating a ton of protein and that increases the production of proteases. Nevertheless, these proteases are not good because they can break down those tight junctions inside the gut and cause potentially leaky gut. So eating a high protein diet is not necessarily good. Again, I'm going back to saying, look, eat a lot of fiber. Yes, you may have a little bit of a hard time with the gas production because you're more sensitive to it, but eating more protein may be a short-term treatment because you're not getting as much gas, but you could be causing harm to your gut. So serine protease inhibitors are produced by a lot of the bacteria, including also serine protease inhibitors are these guys that actually break down the action of these proteases, but they're usually produced by the bifidobacteria, which actually is deficient in IBS patients. So pretty much these proteases, which are supposed to break, they're supposed to be cleared out of your gut, they're not cleared out efficiently. So they're hanging out, breaking down the tight junctions, and they're not getting cleared as well because of dysbiosis in irritable bowel syndrome patients, and decreased levels of bacteria such as bifidobacter that clear out these proteases. So another way of showing you how a high protein diet is actually could be bad for you is that when excess protein is consumed, it goes inside the colon, inside the large bowel, and actually gets fermented by the gut microbiome to things like ammonia and amines and hydrogen sulfide and phenols, indoles, and these are actually literally toxic to the gut. So when my patients come in and they say, you know, I switched to a high protein diet because carbohydrates are just not good for me because they cause problems, I feel bad for them and I have to sit there and counsel them. Don't do that. A high protein diet is not the treatment choice you should choose. I'm not saying eat a low protein diet. However, you should eat a whole food plant-based diet, which contains right about the amount of protein that you should consume. What are some of the testing, diagnostic testing for IBS? Well, when you meet your doctor, they'll do a comprehensive blood count, stool for blood, because if you have blood in the stool, you need a colonoscopy. You will have a routine colon cancer screening test to make sure this pain and diarrhea and constipation is not due to some kind of a colon cancer. You'll have inflammatory markers to make sure that you don't have some kind of a inflammatory bowel disease. Calprotectin does indicate whether there is inflammation. You'll have stool cultures to make sure it's not some kind of an infection. You may have a colonoscopy to make sure you don't have microscopic colitis, other types of colitis, and that it's just IBS. So red flag signs will have to be ruled out, and your doctor will do that for you. But once they give you reassurance, I do not want you to go doctor shopping and keep spending thousands and thousands of dollars on alternative stuff, you know, colonics, which destroy your gut microbiome. I mean, I've heard it all. People do all kinds of stuff that is just futile and actually unnecessary, and it's just draining your pocketbook. There's this new test for IBS, anti-CSTB antibodies and vinculin antibodies. The specificity and sensitivity of these tests are not promising. They're expensive and they don't add anything to the clinical picture of IBS, so they're unnecessary. So then what is the therapy for IBS? Well, you know, number one, I think it's so important that once you have had the workup, that your doctor gives you reassurance that this condition is not going to kill you. It is extremely painful. It's extremely uncomfortable, but it's a chronic disease and we have to get along with it somehow. And we may have to first go the nutrition round, and we should always go to the nutrition round. Eat a high fiber diet with the help and guidance of a registered dietitian who knows what they're doing. My registered dietitian is probably listening right now. She's trained in treating you with IBS SIBO and can make sure intelligently help you avoid things that you should be avoiding and introducing things that you should be introducing in your diet. She will not take away the FODMAPs. She would help you design a program that has all the nutrients that you need without hurting your gut microbiome balance. So nutrition therapy is number one, first and foremost, the first thing you should do. Some people will continue to have problems. And once you've had medical therapy, nutrition therapy, and you have the diagnosis of IBS, I suggest that even though nobody likes to be on medications, that you should try the medicines, because your poor quality of life it's not good to go on having a poor quality of life and suffer. And this suffering will go on and on and on. And believe me, there is no magic pill. So this is where people start trying weird, like super weird herbs that actually hurt their gut. They do all kinds of strange things like detox programs, which are terrible for you. I mean, I've seen it all, you guys. Don't try these things. In fact, you should try clinically proven evidence-based medications that have worked. This is if nutrition therapy fails. Antispasmodic drugs such as Bentyl and hyoscyamin have shown to help. Low-dose antidepressants are very helpful, if in particular if you have depression and anxiety. If you're super constipated and you're eating the whole food plant-based diet, I don't know what to tell you. You've got to intervene with some kind of laxatives or motility agents. And I see people load themselves up on magnesium, and that's not a good idea either. I think you should talk to a gastroenterologist and get some help. If you have severe diarrhea, some antidiarrheals are helpful. And of course, manipulation of the gut microbiota is so key. And how do you do that? You have to eat a high fiber diet, albeit sometimes you will have a little more gas, but just remember that this gas production doesn't mean that it's hurting you. It's just basically a little bit less. The gas is staying around a little bit longer, and it's not evacuating as readily as it should compared to normal people, and that you will be fine. I'm going to have to wrap up. Psychotherapy is actually super important. If nothing else helps, after 12 months, I would highly recommend a cognitive behavioral therapy, because the brain and the gut are completely connected, and all the stress hormones can aggravate your symptoms. And so definitely, this approach is definitely completely appropriate. So in conclusion, IBS is a chronic disorder of the GI tract. It's very common and associated with psychological disorders. It's not genetic, it's mostly environmental, and nutrition has a lot to do with it. And if you ever get a gastrointestinal infection, that has a lot to do with initiation of IBS. Eating a healthy, nutritious diet is important in controlling inflammation, balancing your gut microbiome, and repairing the gut lining, but it doesn't cure IBS. In many cases, you should try some kind of medication to control your symptoms. And providing reassurance is very key, because people spend thousands and thousands of dollars on IBS. And that's it. I just want to show you my dietitians. I'm so proud of James and Dahlia Marin, because we've been working together from day one of Institute of Plant-Based Medicine and even before that. And they are experts in gut health. If you need any help, they're here to help you.
Dr. Sadeghi, that was incredible. One thing, I actually fell asleep at the very beginning. So could you start over at the beginning and just do the whole thing over?
So I was going to quiz you, then I won't in that case.
No, that was actually fantastic. The chat box was going crazy as you were going through this whole thing. And I know that you had to cut it down a little bit short, but we just want to be respectful of people's time. So let's do, for basically the next like 7 minutes or so, let's try and rapid fire questions. Are you cool with that?
Cool, totally cool with that. And I'll try to answer quickly so we can get to as many questions as possible.
Yeah, I have the same problem as you, where I'm like, well, I'm glad you asked. And then half an hour later, I'm like, does this make sense? Okay. People are asking, does it help to take a fiber supplement, and or do you recommend taking a prebiotic or, eating prebiotic foods or taking probiotics, or both?
So eating prebiotic-rich foods are absolutely key because of the short-chain fatty acid production that heals the gut. Taking probiotics is not, most of the time, not recommended, because it's very hard to find the right, it's just the research is not available yet to know what kind of probiotics to take. So just focus on taking prebiotic-rich foods. Okay,
this is fantastic. So I heard on the internet and in the blogosphere that lectins are bad for me, because that's what I'm being told by the people who espouse sort of lower carbohydrate intake. What's the truth about lectins? Is that true? Should I be avoiding them? And where are lectins? It's not
evidence-based, and most of the lectins get, for example, you'll find those in legumes, but when you cook them, they're pretty much essentially eradicated. So that is, those non-evidence-based stuff are totally floating around on the internet. Ignore it. it's basically, I don't know. I mean, I think in the interest of selling some supplements out there, and it's not evidence-based, so I don't know what to tell you.
Yeah, I mean, I think that's a perfect answer. Another thing too is that you mentioned that saturated fat is something that can be actually very detrimental to your gut health for a number of reasons.
Yeah.
In the world of low carbohydrate nutrition, which seems to be very popular these days, they're telling you that saturated fat is not correlated with increased LDL cholesterol. Saturated fat is not bad for you. Saturated fat does not cause insulin resistance. Saturated fat does not harm your gut. In fact, saturated fat actually heals your gut. They're saying the exact opposite thing as you. So why is that being said, and why are people confused?
Notice I laughed. So saturated fat has shown to cause increased bile acid production, which turns into secondary bile acids, as I showed you, and it's toxic to the gut, causes diarrhea. Saturated fat has been correlated to breaking down the tight junctions between the cells. Again, not good for you. Now, good fats like avocado fats and nuts and seeds fats, those actually repair the gut. Alternatively, saturated fat actually harms the gut.
Okay. Quick follow-up question. Why do people claim, or why do people report that when they switch to a diet that is high in fats, low in plant material, and low in fiber in general, that they get a lot of resolution of their digestive symptoms?
Absolutely. You see, I showed you that gas clearance in IBS patients is a little bit delayed, and there is dysbiosis, so there may be more gas producing bacteria in the gut of patients with irritable bowel syndrome. So they get a little bit more exaggerated response than someone without IBS. So there's no question that they may suffer a little bit more than normal people with no IBS when they eat high carbohydrate rich foods, right? But the fact is that they should continue eating that way, because those short chain fatty acids are actually helping heal the gut, and that excess gas production can be controlled by certain medications or certain ways of eating. For example, maybe eating a smaller meal. So you shouldn't shy away from eating carbohydrates because of the gas. If you eat a high protein diet, high fat diet temporarily, because there's less carbohydrates in there, you may temporarily have a little bit less gas production, but in the long run, you're shooting yourself in the foot because you're causing more dysbiosis, more damage to the gut.
Okay, so let's take a patient who currently has either IBS or SIBO and has a significant amount of discomfort in their gastrointestinal tract. You're recommending that they eat a more fiber-rich, plant-rich diet, which I am on board with. But a lot of people find that once they start to integrate more fiber into their diet, it triggers their symptoms, and all of a sudden they start to feel worse, okay? So if somebody's already living with one of these conditions, how can they actually transition to a plant-based diet without experiencing more pain?
Yeah, so number one, it's very widely recommended that you slowly increase the fiber-rich foods. Yep. So legumes may not be the first things you may want to try. So you want to slowly ease yourself into it. Eating cooked foods seems to be more tolerable, and you should always do this with the help of a registered dietitian, and slowly incorporate these fiber-rich foods into the diet, where you are not like blowing up on day one. If you ate a ton of fiber and you're not used to it, you will get super bloated. So it's a slow transition. With the help of a registered dietitian, I always tell people it's very hard to do it yourself. And lastly, if you're getting excessive gas and bloating, that does not mean that you're making yourself worse. See, that's key, because a lot of people, the alarm goes off and they're like, oh my God, I just ate, let's just say I ate a big piece of meat and I didn't have bloating, but I ate that broccoli and I had a ton of bloating. So therefore, this is bad for me. Look, it's not like that. Just because you had a little bit of gas production, it doesn't mean you're being harmed or you're harming yourself. It's just a little bit more gas production. So I want to give people reassurance that just because you're eating more fiber-rich foods, it's not like you're harming yourself, right? It's just the gas doesn't get cleared as fast, and you may have more bacteria in your gut that produces a little bit more gas than usual. You're not harming yourself. So that's what I wanted to get across.
That's a very good distinction, actually. I remember speaking with James and Dahlia at a medical conference about a year ago, where they walked me through verbally the protocol for how they would transition someone to a higher fiber diet. and they were explaining to me that it has to be a very stepwise introduction of various foods, because not all fiber is created equal. Certain foods have different types of fibers. Certain types of foods are more complex to digest than other types of foods. And so just like you're saying, if you work with a registered dietitian who can really transition you in a step-by-step manner, you can get to a point where you're not eating very much fiber to eating substantial amounts of fiber, correct?
Absolutely. And that is always the goal. The goal is to eat more fiber, not be restrictive. So Cyrus, I have a lot of patients who come to me and they're like down to eating 2 foods. Like they're eating bananas and avocados. And it's frustrating because that is exactly what we don't, and it actually creates eating disorders. It's bad. Like, so when you're having symptoms, you eat a meal and a lot of people say, oh, it must have been that one thing. They pick out one ingredient out of the meal and they blame that one ingredient, like the onions or the garlic or something else, and they stop eating it. And then they get this bloating again, obviously, because they're going to get bloating anyway. And they go, oh, that was bad too, so let's stop that too. So then the 3rd ingredient, the 4th ingredient, the 5th thing, slowly they get more and more restricted. Every time they have a little bit of gas and bloating, every time they have a little bit of pain, they become more and more restrictive, which is the exact opposite of what you want to do, right? You don't want to get restrictive. You want to actually add more foods, more fiber-rich foods, and not get restrictive. And so IBS and gas is going to happen. You have IBS, so don't keep getting restrictive because you have gas and bloating and pain. That's where I always say, this is where you practice integrative medicine, where you use medications to give you comfort, and so you can eat the foods that you love and that are helping you. You see, this is one situation. It's like, if you have insulin-dependent diabetes, you should eat a whole food plant-based diet, but you shouldn't stop using your insulin.
Right.
You see what I'm saying? Yeah. You've got to do both. And this is where in the world of GI, it's the same thing. You can help your gut with eating a fiber-rich diet, but you should also use some of these medicines so you can get comfortable, so you can eat more of them.
Correct. Okay, very good distinction. This is extremely helpful. How would somebody know if they should go get a test for SIBO? What are the particular symptomology that they should be paying attention to?
So there was a time where SIBO was way underdiagnosed, and now it's like way overdiagnosed.
No, I know, it's all over the place now.
Everybody has SIBO. Okay, so SIBO, it manifests as extreme bloating after eating, and excessive flatulence and excessive burping, and people looking pregnant after they eat. There is a breath test that your practitioner could, your gastroenterologist or whoever, your doctor could order, and they let you fast, and then you take this sugar solution, you blow in a tube, and if you have excess gases, that means that you're having excess gas production in your gut. So people have to remember that IBS causes bloating too, right? And so you don't want to get caught like killing the SIBO all the time. People go, I have to kill the SIBO. And so they do these extreme diets, extreme detoxes, and they try to kill the SIBO, but they're killing their good gut microbiome too. There's no way that you can only kill the bad gut microbiome. There's no way. And a lot of times people get sucked into these like, recurring alternative medicine ways of doing things, and they actually ruin their health even more. And trust me, herbs are just as potent as antibiotics. I mean, there are herbs I use for SIBO that are just as potent as antibiotics, and they shouldn't be used readily and too loosely. They shouldn't be incorporated in the treatment too loosely. It's got to be well thought out.
Ah, got it. So you got to do it under the guidance of a medical professional, rather than just saying, oh, I read about this herb on the internet, let me go take this thing. Maybe that's going to help.
Yeah, and sometimes they give you temporary relief, but what are you going to do? Live on these herbs for the rest of your life? You've got to make sure that everything you do is well calculated. So, I mean, you may want to live on those herbs for the rest of your life. I don't know, but it needs to be discussed with your doctor, and it has to be done on a systematic, in a well discussed manner.
Okay, last question for you, and I know we got 1,000 questions we could go through. Is there a connection between alcohol consumption and IBS? Is it helpful or is it detrimental?
Okay, so alcohol, in my experience, it can induce, first of all, we know alcohol can cause leaky gut. So, and one of the reasons, or the pathophysiology of IBS, one of the pathophysiologies that I described was leaky gut. and gut microbiome dysbiosis. And alcohol can do both. So yeah, if you have IBS, you may want to stay away from alcohol or minimize the use of it.
Okay, very, very helpful. This has been very eye-opening, actually, because correct me if I'm wrong, the gut is the root cause of most, if not all, chronic disease, correct?
I'm very gut-centric, so I'm going to say yes.
Yeah, sure. Who was it?
mean,
Hippocrates who said that way, back in the day, I believe?
I'm not sure, actually. I'm not sure, to be honest with you. But, inflammation, a lot of inflammatory processes start in the gut. Remember, I showed you the cells and the lamina propria right underneath the gut epithelium, which has all the white cells hanging around. And whatever you're ingesting can directly cause inflammation, which right underneath the gut cells, which can spill over into the rest of the body. So if you want to have a healthy body, health starts in the gut. And I think that everyone should respect gut health, which is directly associated with good eating and a healthy diet.
Absolutely. I think for people who used to have a poor functioning gut, who then ate themselves into a better functioning gut, they understand the value of having awesome digestive processes, right?
Absolutely.
And they understand that like it has an effect on many different systems within your body, blood flow, how your brain operates, how your thyroid gland operates, how your insulin production is, you name it. But for those people who haven't experienced it, or maybe you're going in the wrong direction and say, oh, my gut doesn't work right, I have gas, bloating, constipation, diarrhea, abdominal pain, you name it, it can feel a little bit like the world is sort of closing in on you very quickly, right? But if you feel like that, trust me when I say that Dr. Angie Sadeghi's information here can truly make a big difference in your life. So as always, try and transition to a plant-based diet. Specifically when you're dealing with gut issues, make sure the transition is slow, step by step. Don't just try and eat a whole bunch of fiber all in one shot and then hope that all of a sudden your symptomology goes away, because it could act like you're pouring fuel onto a fire, and it can actually trigger a bunch of symptomology, which will make you feel worse. So Dr. Sadeghi, thank you so much for being here today. Really appreciate it.
It was my absolute pleasure. Thank you for having me.
Absolutely.
Always glad to share information with people.
You're very good at it too. You're very good at it.
Thank you.
And for those of you that are still here, we got another 1,200 of you. Remember to go check out the Forks Over Knives meal planner if you haven't already taken a look at that right now. Go to forksoverknives.com/loveplants. You can get a 2-week free trial there. Trust me when I say it is without question the greatest meal planner on the market today. And I am not paid to say any of this. I am telling you my honest opinion. It is a phenomenal tool, and it can help you really understand what to eat, how to eat, and how to save time and money in the process. So forksoverknives.com/loveplants. Thank you for being here today. Thank you for taking time out of your day, and thank you for your interest. We will see you guys in the next installment of the Forks Over Knives webinar experience.
Bye, everyone.
See you guys.